Sophie was born 5 months ago. It was a pretty eventful birth. During my labour, Sophie went into distress, and so I ended up having to have an emergency caesarean, and I had fantastic care, and I think they probably saved her life. When you have a baby that has complications during their birth, then obviously it takes more time to look after them. She had to have her blood sugars monitored, she had to have extra checks. It put so much more pressure on the midwives because they had to spend extra time looking after those babies as well as the mums. And because of my surgery, it was very hard for me to move very easily, and I needed support to do everything. And because the ward was so busy, there were times when she was hungry and they would, call me to come down and feed her. But there was a delay in getting the message through and being able to get somebody to come and get me in order to wheel me down to feed her. So there were, a couple of times when I would arrive and she was crying and in a bit of a state because she'd been waiting to be fed for, half an hour. There were times when the midwife would come in to help me have a shower, but at the same time I was being called down to the nursery to feed Sophie, and my priority was going to the nursery to feed my baby. So it made it very stressful and very tiring time in hospital. I think that if there were more staffing and if the staff weren't stressed, there would be less miscommunication, because often when staff are busy and things get missed, then the people who get blamed are the midwives who are on duty. And a lot of the time it's not their fault that people have called in sick or there are not enough staff. Mothers and babies need to be supported, and it comes down to supporting public health and knowing that when you have a baby in the public health system that you're going to have the best care available.